My name is Magen Heide, and I'm a primary care internal medicine physician. A typical day for me, I'm normally up before 6, usually starting my day with a cup of coffee, getting ready for the day, try to have a healthy breakfast, and I'm usually saying goodbye to my husband around 7 or just before 7 and heading out the door. I like to get to the office early before things are busy or chaotic and take some time to look through my chart messages and kind of get started with the day. I usually start seeing patients at around 8 a.m. I have a mix of virtual and in-person appointments. Look in your ears, check your thyroid. In between appointment times, I'm usually trying to make sure that medications are being refilled, doing administrative work, my chart messages, answering emails. And sometimes I have a resident come and rotate with me. I'm part of a program that exposes interns to primary care, but you'll kind of see how I go through the flow of a normal physical. Cool. Because we don't get to see that a lot. Good morning.
Good morning.
In a typical day in the clinic, I see a wide range. I see patients 18 and older, so I might see a 19-year-old that's graduating from pediatrics, and I might see a 99-year-old who has a lot of chronic medical problems, and we're talking about medication changes. Let's look at your blood work. So newest one's on the left. Your blood counts look great. No issues there. Liver numbers are good. Glucose is up. I have the pleasure of taking care of a really wide and diverse patient population. Usually my day is a mix of people coming in for their annual checkups and talking about preventative care. But then we also have acute visits, people that are sick or something's going on, or we need to make medication changes. So big variety.
Thank you.
You're welcome. Now I'll see you in a couple weeks.
Yes, you will.
All right.
Thank you.
Talk to you later. Just pit stop at the window, okay? Tuesdays are my favorite day of the week. I'm normally done seeing patients around 11:30. Finish up my computer work for the morning and then head over to the resident clinic. And it's great because I went to residency here, so I'm getting to teach and kind of give back to the program that helped train me. In the resident clinic, we will see a variety of patients. I will primarily be in a supervising role as the attending physician. After the patient is seen by the resident will come and talk to me about what they saw, and then we'll come up with a plan together. I wrap up my day and head home around 5, and usually I'm looking forward to a meal that my husband and I planned on cooking together. And oftentimes during the week, I've got a workout class in the evening, and then just looking forward to starting the next day. I love my patients. One of the best parts about being a primary care doctor is that I have these long-standing relationships with my patients. We get to know each other well. They send me messages and update me when their kids get married or when they have a health change with them or their spouse. Those relationships with patients, that's what fills my cup at the end of the day. I have really always wanted to be a doctor. I've always loved the sciences, loved how the body works, and I, most importantly, always wanted to live a life of service and wanted to serve others. That was the best way for me to do that, is to be a healthcare provider and take care of others in their time of need. Hello, my dear. How are you?